Hi, everybody. I'm Steve with Fitness for 5 and Fitness for 10. Here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can look them up online, check out their website. They're in Reno, and see what kind of services and treatments that they do. So, hello, doctor.
Hi, Steve. Thank you for the invite again.
So, let's talk about stress today. So I know stress affects so many different things. I mean, again, I'm not the doctor, but I'm in the fitness industry, and it just seems like stress can lead one thing to another and just affect so many things. Um, so, uh, obviously it's something that we want to keep under control, but let's start with, how does it affect the brain? Because I mean, does it start there where stress affects the brain and then it goes from there?
Yeah, so good point, Steve. The thing here is with stress, it always affects the machinery, and our machinery is the brain. But thing is, let's define stress for everybody. Stress, I have to tell everybody that it's subjective. When somebody honks a horn, of course, some of them will move forward, right? But some other people will pull their hair out and flip the bird on you. So it really depends on how you perceive it. So it's all about the stimulus that brings the distress to our feeling of well-being. That is basically is like this stress destabilizing your normalcy or your balance. When it's an acute stress, it's good. It promotes adaptation. When it's chronic stress, and especially prolonged, it exhausts our mechanisms. Now, the brain changes with chronic stress, and the amount of chronic stress is increasing for many of us. It's just that that's how it affects that machinery that I'm talking about. Right now, how does it affect us? We're evolving much faster as a human race. Right now, indoors alone, we were indoors before because of COVID, and some of us still are doing this. Some, and we become inactive, no exercise, and now the industrial revolution is at hand. iPads, phones is keeping us busy, not even making us go out and interact with real people anymore. And this is where information is now rapidly more available. Social media, news, email, reading all of these things brings stress to us. Depends on what the content is. And we have less downtime because now every day is just a rush. It's a never-ending to-do list that we have to accomplish. And accumulation of this stress, especially in a good sample subject for you, were the adolescents. And they were studied, and they actually saw these teens who are exposed to chronic stress with smaller brain volumes and more anxiety, lower cognitive flexibility and decision-making skills. And when the brain gets used to this is a bad thing. So at least 3 to 6 months of chronic stress is now a bad stimulus to have. Thus, the inhibitory capacity of the brain to protect dies out, and the immune system now activates to produce more inflammation, and same again, brain volume size starts to shrink.
Okay, so when this happens, how do we respond? I mean, how do our bodies, I mean, when that stress hits us and affects the brain, what's a natural response? How do we respond?
Well, Steve, now this is where we apply the term fight or flight response. And animals react to threats like this. And it's the activation of what we call the sympathetic nervous system, the brain expressing reactions through the body. And in the prehistoric times, maybe a better example is this response manifests as a fight response, as aggressive, combative behavior, and in flight as fleeing away from the threat. And a good example is, of course, running away from a dinosaur that's about to eat you. I don't think we're going to have that now, but the changes during this situation in the sympathetic nervous system can be seen in the body as increasing heart rate to make sure that we get the blood flow to these organs. increasing the bronchial passages so we can inhale more air so we can run farther away from the dinosaur, decreasing the movement of your gut. It's not time to poop when the dinosaur is running after you, right? Dilated pupils. It just blurs your vision because you're just, yeah, we're blacking out when we're stressed. That's what they use it for. And also more perspiration, sweating, because of course it's a high stress situation. But in current times, this dinosaur is not there anymore, but it is now represented by different situations. For example, the fight response may be manifested as anger, argumentative behavior about COVID, what's in the news, what to watch in Netflix. And the flight response may be manifested through social withdrawal, substance abuse, depression, and even more television viewing. Males are likely to respond in an emergency situation with aggression, the fight, while females are more likely to be fleeing, mostly, as I use the word, or the flight, turning to others for help or attempt to diffuse the situation, or using the befriending mechanism. And during stressful times, a mother is especially likely to show protective responses toward her offspring.
Okay, so is there a way that our bodies naturally counteract stress?
There is, Steve, and this is now what we call the parasympathetic nervous system. And this is the relaxation response. It's the opposite of the fight response or fight or flight response. And now the body and the mind has a way of returning to the physical and physiological balance of harmony. And the brain gets the message that there's nothing to be afraid of anymore. The dinosaur is gone. It's out. It moved away. And it restores the mind and the body to be in a relaxed and calmer state. That's why the symptoms of slowing down the heart rate, constriction of the muscles of the pupil again, and then also the saliva now is increased so that we can now eat to promote digestion, because the dinosaur, you don't have to be preoccupied with that guy anymore. And also it stimulates the digestive enzymes to start the digestion, and you can eat food properly. And you can urinate now, thus increasing the excretion of urine through the bladder. Thus, we need to promote this parasympathetic stimulus or response. This is also something that we emphasize in anti-aging medicine, because this is more of cell preservation than cell destruction.
Okay, so you talked about, being able to relax. How would Western or conventional medicine address this, in stressful situations?
Right. There are different ways in how conventional medicine can actually respond to this. So there are many different medications that we actually use to relax the nerves as medical doctors, and including anti-anxiety drugs such as the benzos, as we hear all the time, and typically prescribed or used for in a short-term basis. So you would hear about Xanax, alprazolam, Valium, diazepam, the PAM family, and newer options like the antidepressants, which are the SSRIs, often recommended as a long-term therapy in anxiety situations or solutions. And these are the stressful situations that I'm comparing it to, such as Prozac, Zoloft, Lexapro. But I have to remind you, this only provides temporary relief, and side effects are the ones that we worry about: drowsiness, fatigue, GI problems. And the American Academy of Family Physicians actually says it is not a cure. Benzodiazepines lose their therapeutic effect after 4 to 6 months of regular use. And even the Journal of American Medicine says the effectivity of antidepressants, such as SSRIs, is no better than a placebo. It's difficult to get off these anxiety medicines. And that's one of the problems, especially without withdrawals. They usually have side effects. And inclusive of this is the rebound anxiety that it can be bringing to the table, even worse than the original problem.
Okay, so what about, I know there at the clinic you use a combination of things, but what about natural ways? Is there anything that people under stress can do naturally, or natural treatments, or take that angle, on reducing stress or
right,
combating it?
Yeah, so that's a pretty good point, Steve. This is now where we get into more of the action rather than just the thinking. There are a million ways to skin a cat, as we always say. And here are examples of the most famous methods that I've used in my patients. So one is guided imagery. So this is the lazy person's meditation. As you all know, it's hard. There's always hard times when we're concentrating and focusing during meditation, and we get fidgety. We're thinking of so many things as we close our eyes. Oh, what's in our social media? It's like when we see a butterfly and we follow, ooh, butterfly, and then you lost track of what you're doing. That's how hard meditation is. And guided imagery it's like meditation for dummies. What does it do, or what does it entail? There are actually instructions for you to imagine images that relaxes the brain, and it brings you to a more relaxed and easy state. And you can actually use YouTube. So you just type guided imagery, and you're going to look at an image, and it will tell you instructions on how to follow it. And one example would be there's a video of a stream of water or river, and the voiceover will instruct you to breathe in the pattern the same as the stream as it's flowing. And you have to imagine it with eyes closed. And there's also calming music at the background. So it's all about closing your eyes, getting comfortable, and following along. And this is very good for beginners. Another one would be heart-focused breathing technique. So focus on the heart area and imagine. So again, this is all part, the imagination is a big player here. Breathing flowing in and out, air flowing in and out of your heart and chest. And you breathe slow and deep with a comfortable rhythm. And the best pattern would be 10 seconds inhale, 10 seconds exhale. So do that over and over again. And this is actually one of the better ways to control heart rate variability, which is a good parameter to assess parasympathetic dominance or the vagus nerve. But in our clinic, we do acupuncture. This is actually sensory stimulation. We use needles. It affects temperature, cardiovascular system. It actually been used to control blood pressure and heart rate variability via the parasympathetic nervous system stimulation. And recent research suggests that acupuncture stimulates the release of oxytocin. And we have spoken about oxytocin before in our segments, but it is a hormone of signaling that regulates the relaxation or the parasympathetic more and making it even more enhanced.
Okay, well, good information. We know stress is something that people have to deal with at one time or another. So we thank you, Dr. Nario. Dr. Nario, Biointegrative Health Center in Reno, Nevada. Check him out online. Thanks for being with us, Doctor.
Thank you, Steve, for having me again. As you all know, the knowledge is